I'm Dr. Nahim Mizan of Mizan Coaching. Sorry about that, guys. So I am Dr. Mizan of Dr. Nahim Mizan, or I am Dr. Nahim Mizan of Mizan Coaching LLC. I am a family medicine physician turned medical legal consulting doctor, and I literally help everyone. I help patients, I help hospitals, clinics. Sometimes medical malpractice, personal injury attorneys consult us for simply advice. But my job really is patient advocacy. And because I'm in such a weird niche field in the world of medicine, I actually stumbled upon an insane discovery, and many of my videos talk about this. And I implore you to watch our videos on this subject. Basically, it's on how the US healthcare system has, in my opinion, it's already collapsed. And I know that that sounds a bit hyperbolic, it sounds like an exaggeration, but week after week, I read news. Many of my colleagues, many of my clients have been telling me that, nearby hospitals are literally closing down and patients are now having to go, drive 50 miles away, 100 miles away in order to simply get adequate health care. This is a huge concern. As of today, RFK Jr. was just, sworn in. So I'm hoping, I'm an American, so I don't believe in political parties. I'm an American. I believe in this country. And I truly hope that, the powers that be make a good decision and the healthcare system improves over time in the next 4 years. What we're seeing now is that pharmaceutical companies and health insurance companies basically run medicine across the U.S. So all of the many of the protocols and the administrative policies that hospitals engage in, believe it or not, are not dictated by physicians or even hospital administration. It's literally written by insurance companies and pharmaceutical companies. And because I'm this like I'm like sort of like a rogue doctor that doesn't work in the healthcare, in clinical medicine anymore. Like I work in a consulting aspect and I work with many different clients across the US and Canada. I'm basically privy to a lot of these things that are happening behind the scenes. Um, so hopefully people will join. It's a weird time. It's 5 p.m. CST here. Thank you for joining. Hopefully, like this will be a good use of your evening. It's my wife is actually still at work right now, so thank you for joining. All right, so the first article that we have here today, and again, like all of these, I'm going to verbally state. Hi, Happy Camper. How you doing? Thanks for joining. So the first article that we'll be reading today is regarding Prospect Medical Holdings, and those of you who are in California would maybe know this name. So Prospect Medical Holdings is a company that basically owns multiple hospital systems across California. And again, like this is kind of concerning, and I don't like holding people in suspense. Even with my clients, like I just tell them my assessments really quickly. What's happening across the United States, and we all need to really mobilize and stop this from getting worse and worse. Let's do it. Let's do it. I'm good. I'm good. I'm in. So yeah. So what's happening across the U.S. is that private equity groups are literally buying up hospital systems. So if you guys know anything about this, then if you guys know anything about this, leave a comment below. But like that's literally what's happening across the U.S. right now. Like these private equity groups are simply buying hospital systems, clinic systems, and that's what's basically destroying like the healthcare system all across the U.S. Okay, so this article is on CBS News. Prospect Medical Holdings files for bankruptcy after owners took hundreds of millions in payouts. And again, that's literally just what happens across the U.S. now. So, a Los Angeles-based company that owns more than a dozen hospitals in 4 states filed for bankruptcy late Saturday night, the second major system acquired by private equity to collapse in less than a year. In an initial filing seeking Chapter 11 protections, Prospect Medical Holdings, which owns facilities in California, Pennsylvania, Rhode Island, Connecticut, listed debts of more than $400 million. In a press release announcing its restructuring, the company said that it would continue to operate as normal. Throughout the Chapter 11 process, Prospect Holdings hospitals, medical centers, physicians' offices will remain open, and patient care and services will continue uninterrupted, the company wrote. Prospect Medical's bankruptcy comes less than a year after the bankruptcy of Steward Healthcare, another major hospital system once backed by private equity. CBS News documented how Steward, along with private equity investors, extracted hundreds of millions of dollars from that company, potentially leading to shortages of life-saving medical equipment. Along with Steward, Prospect Medical has been one focus of an ongoing CBS News investigation, revealing how private equity investors have siphoned hundreds of millions of dollars from community hospitals with devastating public health consequences. From 2010 to 2021, private equity firm Leonard Green and Partners controlled a majority stake in Prospect Medical. CBS News has reported on a series of financial moves the company took to issue leadership a $457 million dividend in 2018. Prospect Medical CEO Sam Lee took home about $90 million, while Leonard Green shareholders were paid $257 million. So again, like this is literally what we're seeing, the whole like what happened very recently with the United Healthcare CEO, right? We don't need to really go into that. But this is all happening. It's happening every single day, right? So like there are just health insurance and pharmaceutical companies, private equity groups that are just taking our money. They're just, like people are getting less and less healthcare, and they're just sucking. They're like vampires. Like they're literally just sucking up money. That money that should be staying in the pockets of patients, or that should be staying in the pockets of hospitals so that they can buy more medications, they can buy more MRIs and CT scans, and give fair wages to doctors and nurses, etc. Among the similarities between Prospect Medical and Steward, both of them relied on the value of their hospital real estate to help finance large payouts for their owners. The transactions resulted in onerous lease agreements that diverted funds away from direct patient care. Last week, a powerful bipartisan, and this article was written a few weeks ago. Last week, a powerful bipartisan Senate committee found what it said was overwhelming evidence of financial mismanagement, as Leonard Green and Prospect Medical sought to drive profits, causing hospitals serving vulnerable communities to cut services or close altogether. The Senate committee's findings were part of a 162-page report that concluded private equity's financial model may pose a threat to the nation's healthcare infrastructure, particularly in underserved and rural areas. Both Prospect Medical and Leonard Green disputed the findings by Senate investigators. In a statement, a Prospect Medical spokesperson said the report drew false conclusions and omitted key facts. The committee drew general conclusions about the quality of care at our hospitals without ever reviewing information from these hospitals, which is where the focus on care takes place, rather than at the corporate level, the spokesperson wrote in a statement, noting the company has invested more than $750 million in its hospitals and provided more than $900 million in charity and uncompensated care to patients. Nearly all the hospitals Prospect acquired were cash-starved, neglected, in disrepair, and on the verge of closure or bankruptcy, the spokesperson wrote. In nearly every instance, no one else wanted to acquire them, and many were headed to closure. So, and again, this is something that every single private equity group basically states. They basically say, like, hey, like the hospital was going to go bankrupt, and we did a service, right? Like we injected money into it. We kept it running for however long, like a month, 2 months, 3 months, a year. But in actuality, like what they're doing is that they are literally using the hospitals. They're literally using the hospitals as cash cows, and they're sucking them dry. And then whatever happens to the hospitals, they don't really care, right? Because like again, they're reviving a hospital system. They're making buka bucks due to insurance and taking advantage of patients, getting minimal level subpar healthcare. Um, and then the private equity groups kind of like they pay their CEOs like over here $90 million. Like that's insanity, right? So they're paying them millions and millions of dollars. They're pocketing all the money, and then the hospitals are forced to declare bankruptcy. So, this is extremely unfortunate, but do I think that I'm shocked by this? Not really. No. Because again, like this is happening all across the United States. Um, so, if you guys have any questions, if you have any medical questions, if you have any medical legal questions that you want me to answer, feel free to just, pop them into the comment section below. And if you do have any thoughts on how private equity groups are literally sucking the American people dry, let's talk about it. So, so that was a CBS News article basically on a group called Prospect Medical Holdings, and they basically own many hospitals across basically Southwest United States, so California. Um, Let me take a look. There were quite a few states. Yeah, California, Pennsylvania, Rhode Island, and Connecticut. So extremely concerning, right? Because again, like healthcare should be, in my opinion, a human right. Like it shouldn't be something that only the rich can afford. Um, okay, so that was that article. Okay, let me take a look here. Okay. All right, so the second article, this so this is actually on MLK Hospital, and MLK Hospital is extremely famous. Like it's very well known. It is a staple of Los Angeles. Like they have an amazing pediatric program, an amazing OB/GYN program. Many babies have been born in MLK. It's a community hospital in Los Angeles. Um, Okay, so this article is on beckershospitalreview.com. And again, it's saying the same thing, but again, like what's scary is that this took place this article was written almost a year ago, so June 10th, 2024. Um, that's a really good question, Jasmine, and thank you for being a subscriber. Like I know that you subscribed a long time ago, so thank you. Hope our channel has helped. So Jasmine Fly wrote, "How do I protect my small clinic from insurance clawbacks? It's sinking my business. Is overpayment for service handled the same for large hospitals?" So this is a really good question. So number one, um, like, and again, I hate to be the bearer of bad news, but insurance companies are billion-dollar corporations. So a lot of times, so what Jasmine is talking about is that like many times when we bill certain procedures, as physicians, MAs, nurses, like when we bill certain procedures, our clinic needs to get compensated for that, right? So like, but the problem is that insurance companies are now sort of like the middlemen between the provider and the patient. So a lot of times what insurance does is that they either ask for more money from the clinic, or they simply don't grant the amount of money that clinics and hospitals deserve. So I think the best thing, Jasmine, is really just to bill appropriately, because a lot of times, like what a lot of doctors, NPs, PAs do is that they overbill. And so what's really frustrating is that like, it's funny because my wife and I are both doctors, and, I always encourage her to overbill simply because insurance companies will always take money from your clinic, right? So it's like, in a way to protect yourself, you should overbill, right? But then there are some insurance agents and insurance companies that know that you're doing that, and so they will take more money from you. So, I mean, I wish I had an answer. The answer really is just to bill appropriately. So, if your doctor, actually saw a patient for asthma, like, just asthma management, just bill that, right? Like, in your assessment and plan, just put that. You don't need to say, oh, I saw this and also this and also this. That's something that a lot of physicians and nurses and NPs and PAs are taught, but insurance companies are also getting smarter, in that they don't want to give money to clinics and hospitals. Um, okay, is overpayment for services handled the same for large hospitals? Yeah. So, and it's actually worse for hospitals, Jasmine. So, um, because clinics, like, if you think about it, like, one clinic brings in probably, like, I would say, like, maybe $1 or $2 million a year, depending on the size of the clinic. But hospitals bring in billions of dollars, right? So it's like, imagine a clinic, multiply that by like 1 to 200 patients. So, um, and again, like, all the services, all the imaging, all the blood work that's done. So, like, again, insurance companies have all of us by the neck, and I'm not joking about that. Like, it's like, and I think, like, that's why we created our channel. It's because I'm a doctor that actually sees all of this, and I'm not in the medical bubble. So yeah, yeah. So that's my answer, Jasmine. Hope that helps. But the best thing again is just to document appropriately and to bill appropriately. Anytime. Yeah, it's my pleasure, and thank you, Jasmine, for being a longtime viewer. Okay. And also, I'm recovering from the flu, so sorry if I'm making guttural noises and all that. I hope everyone's okay. I know that, like, the flu, the cold, COVID, RSV is like going around, so hope everyone's okay. All right, so this second article is very interesting. So it's called Los Angeles Hospital on the Brink of Closure. This was published Monday, June 10th, 2024. Again, this is beckershospitalreview.com, and it's about MLK, so Martin Luther King Hospital, which, like, I'm from LA, I'm an Angelino. Like, I've been to MLK many, many times. So it's a great hospital, fantastic faculty. Okay, MLK Community Hospital in Los Angeles could face closure as it continues to deal with overwhelming patient volumes that exceed the safety net hospital's capacity. Community representatives, state lawmakers, and more than 36 providers, nurses, and employees gathered to express their concerns over the hospital status during a June 7 press conference, according to a June 7 MLK Community Healthcare News release. MLK Community Hospital is one of the last hospitals providing critical frontline services to our residents, yet it is on the brink of closure, California Assemblymember Mike Gibson said during the conference. This is not the first time that the hospital has divulged struggles that could lead to potential closure. Last November, hospital leaders shared that the facility was at risk of running out of money to pay its bills in early 2024. Mr. Gibson also pointed to the critical lack of maternity care services in South Los Angeles, with MLK Community Hospital remaining one of the few facilities to run a maternity ward in the area. However, without an increase in state funding, the hospital could now run dry of operational revenue by early 2025. When the hospital opened in 2015 with state funding, around 30,000 annual visits were projected for its 29-bed emergency department. The hospital saw 4 times that amount of annual visits in 2023, with 76% of the visits coming from Medi-Cal, which does not repay full care costs to providers. We lose we lose money on every one of those patient visits, a significant amount. Elaine Batchelor, MD, CEO of MLK Community Healthcare, said in the release. As the volume grew and continues to grow, we began to lose more and more money. So again, like, this is literally what's happening with MLK is what's happening across the US. Like, and again, I don't want to blame anything, but COVID-19 really did a number on the American healthcare system. And, there's a lot of ideas as to why, but one of the biggest reasonings was that the economy was literally plummeting. Like the economy was plummeting. Um, like there wasn't a lot of money going around. Like so, and also hospitals basically became over encumbered. So basically, like I remember when I was a resident during COVID-19, um, and we were all like completely burnt out. Like, like each doctor was seeing over like 25 patients a day. And these were inpatient, intubated patients or patients that were extremely complex, extremely, you know, like a complex. So the word complex in medicine basically means they have many different comorbidities. So like, for example, like asthma, COPD plus CHF, which is congestive heart failure, plus extreme tobacco abuse and alcohol abuse and all this stuff. So and liver failure at da 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 da. So we saw so many things during that time. So like and unfortunately, like there hasn't really been any there hasn't been any state or government aid that has been enough to help with this problem in the United States. Um, my opinion on whether things are going to get better, I, I, I'm usually optimistic about things in general, but I truly don't think that we can recover. And the reason why I say, and I know that sounds crazy, but the reason why I say this is because, like when you become, the way that doctors think is that there's a problem, and then instead of just giving a solution, we create what's called a differential. So a differential basically means, it's like 10 different reasons why a thing can occur. So for example, like if a patient comes in with a cough, I'm not just going to think, oh my God, it's cancer or something, right? So I'm going to create a differential. It's like, okay, it could be asthma, it could be COPD, it could be an upper respiratory infection, could be the flu, could be someone faking it, right? So there's a lot of so there's a lot of reasons as to why things can happen. Um, and so, like basically during COVID, like, there were so many patients and they were extremely complicated. And insurance companies basically didn't want to pay hospitals or clinics. And so hospitals and clinics were basically stuck, like footing the bill. And then after the pandemic, insurance companies just forgot about them. Like they literally just they didn't pay back the hospitals for their services. Um, and so then like what admin did, well, like what administration, like hospital administration did over the past few years is that they've just been firing people. So like like if any of you have gone to the hospital recently, like it's very clear, at least to me whenever I go to a hospital, that there are a lot fewer people. So there are a lot fewer doctors, a lot fewer nurses and MAs. Um, and if any of you have experienced this, like leave a comment below. But there's been a historic number of just layoffs, like across like across the board. So like many of my colleagues have been fired, and these are people that are extremely competent medical doctors, like they hold an MD or a DO. Many of them have been attendings, like in teaching hospitals. But this is a very real phenomenon that's happening. And like I think part of why I do this, like why I run this channel, is because I feel that it's like it's better for people to be transparent about things, right? Like instead of just like everyone suspecting that like there's something crazy going on, it's like, no, yeah, there is something. Like I'm a medical doctor and I'm telling you that there's something going on. Um, so yeah, so like things are, hospitals are closing down, private equity groups are therefore buying up all these cheap properties, like all these cheap hospitals and things. And private equity groups, insurance companies, big pharma, like they're basically taking advantage of us. Like they're taking advantage of the common folk. Um, and I don't think I'm very optimistic about the future of healthcare. And another point is that, one second. And another point is that, a lot of you who are in the healthcare field, like many of the people in my, like many of our audience members or subscribers, like they're also fellow doctors, nurses, MAs, etc., PT, NPs, PAs. What we've noticed is that there's been a shift to what we call mid-level providers. So and they're fine, right? Like I have nothing against mid-level providers, like physician assistants, nurse practitioners. However, the problem is that admin is basically making them do a doctor's job. So, to those of you who are not in the medical world, so like there are different tiers of whatever, right? Like there are different jobs in the healthcare world. There are doctors, there are specialists, there's nurses, there's MAs, there's physical therapists, there's dietitians, etc. So these are all fine, right? Like we need everybody in order for the system to work. So you need like a round cog, you need a square cog, you need all of these different people. But what's been happening is that because administration is, because their money is being sucked dry, they can't afford to keep all of these employees. So they can't afford to keep this many number of doctors, this many number of nurses. And so the responsibilities are bleeding into each other. And this isn't good because, for example, I'm a family medicine physician, right? I'm not a surgeon. So if someone forces me to do a surgery, I'm gonna pray for that patient, right? Because like I'm not good at surgery. I hate stitching. I'm terrible at closing up. So but like that's what's happening across the US. Like we have nurse practitioners that are basically getting independent practicing rights. And it's like, for some situations that's okay, but a doctor is someone who's had like 30 years of education on becoming a doctor. So it's like we need NPs, we need PAs, but we all need to stay in our strengths, right? Again, like I like me first. Like I'm a general medicine doctor. I'm not gonna pretend to be something else. And so and also like the other thing is like you don't know what you don't know, right? So for example, like I have a colleague who's an orthopedic surgeon, and whenever he gives advice on diabetes, I kind of laugh internally because he's giving wrong advice. So it's like you're in orthopedics, you're a bone doctor, like you're good at hammering bones and stuff, but you're not great at endocrinology or diabetic management, right? And so, but does that make sense? Like basically the ship is losing sailors. So now like the few sailors that are left are having to do each other's jobs, and we're having to do many different jobs. This isn't good, right? Like this is basically like the fall of the Roman Empire. Like that's what we're seeing in America right now. In specifically the healthcare world. Um, Exactly. Yeah, Jasmine. That's I 100% agree. So it's and that's exactly what I'm saying. Like you're an amazing NP. Like I can already tell. Like so and again, like this isn't just with NPs and PAs, by the way. Like there are doctors that try to do other things. Like like we actually had a case and again, I can't reveal personal information, but like we had a case about a month ago where a one of my colleagues, like not like a family medicine doctor, basically was acting like a patient's cardiologist. And so instead of referring that patient out to an actual, like accredited cardiologist, this family medicine doctor was basically pretending to be a cardiologist. And so the patient ended up, like he was on like three different antiarrhythmics. And so then what ended up happening was the guy had a massive myocardial infarction and died. And again, like, like it was very sad because, that doctor was in his head, like in his deposition, he was doing something good, right? Like he was like, oh, but, I have such great rapport with this patient. Like I have such great rapport with this patient. Like, I wanted to help him. I didn't want him to go to a different doctor and like, spend more time, waiting for a referral. But it's like, no, dude, like you're not a cardiologist, right? So don't pretend to be one because it ended up with the death of a patient, right? And again, like, Jasmine, exactly what you said, like what's happening now is that like, and I'm sure this is how it is in your clinic, like one medical doctor has to oversee like multiple NPs and PAs, right? And so each of you guys have like what 10, 20 patients. And so then the doctor also has a bunch of patients. And so how is the doctor going to supervise everybody? That's not humanly possible, right? So it's like, they created a problem, and then so like all, the private equity groups that they created a problem that never existed before. And so we are all paying the price, by the way, right? So, and again, being a medical legal consulting doctor, like I'm very tired of, yeah. So I'm very, very tired of what's going on because I'm getting so many cases, and the answer is always like, I can't do anything about this. Like, it's like, I can't fix any of these problems. Like the most I can do is just tell people what's going on. That's really it. Um, but it's getting worse and worse actually. Like I started back in August 2021. So I became a medical legal consulting doctor in 2021. Now it's 2025, right? So it's been 4 years. And to be very frank with you all, it's getting worse. Like we're getting more medical malpractice lawsuits. And again, like the issue is like no one is a bad person, by the way. Okay. Like there's no such thing really. I mean, there's some evil people out there, right? But like there are no such, like doctors don't become doctors to do evil. Like, that doesn't really happen except for those few, psychopaths and stuff. But same thing with NPs and PAs and nurses. Like we all go into healthcare because we truly, truly, truly are altruistic humans. Like we want to sacrifice like 20, 30 years of our lives in order to help people in a medical capacity. And so, but these business people, they don't care about that, right? Like it's like business people don't care about they don't care about anything. Like they don't care about patients, they don't care about medicine, they don't care about science, like they don't care about emotions. Like their job is just to make the beans increase, right? Like they just want to make the amount of money go up. Um, so if that means getting rid of half the staff of a hospital, they're going to get rid of more than half the staff of a hospital, right? So it's very unfortunate. So yeah, so that was the second article. Yeah, and again, like there was a video that we produced a few. When was it? I think it was like back in November. Oh, sorry, no, it was back in October. But back when Hurricane Helene, remember that? Like in all the way back then in October, right? Um, so so with those two major, there was Hurricane Helene and there was a different hurricane I remember, but they basically destroyed this one of the biggest IV fluid manufacturers in America, and that was based in Florida. But like there were a few factories. So one was in North Carolina. I think one was in like Florida or somewhere. There was another in like yeah. So basically about like 60% of like America's, IV. So that stands for intravenous fluid. So it's like normal saline, ringers, lactate. So a lot of these fluids were produced by like just a single company, which I thought was insane. And like, I dug into it, and there's a reason why it's a single there's a reason why it's a single company that basically like makes all of this, and it's very sad. It's again like the American idea that like you can just patent everything and like not share life-saving things with others, right? So um but basically, what happened then is that hospitals across the United States did not have IV fluids, which is extremely sad, right? So, like many hospitals, we actually made a video on it. So if you guys are interested, just look in our video history, and you'll find it. But basically, some hospitals were literally using Gatorade instead of IV fluids. So yeah, it was a very devastating time. But again, like these things happen from time to time. It's a natural disaster, and again, like the United States really is not very well prepared. Like if you look at and I do a lot of global medicine, so I travel the world, and I travel to Europe, I travel to countries in Asia, and what's really fascinating is that like America gets a lot of things correct, but there's a lot of things that other countries do better, and I think that's just normal. Like no country is perfect, right? So but like for example, Singapore handled the whole pandemic very, very well. And in America, people were like panicking, and there was a lot of distrust and a lot of like schisms. But these things happen. But yeah, like, like basically in an emergency situation, it's like resources need to be distributed, equal, like not equally, but equitably, right? So like places that have much more need, they need more resources, right? And places that don't need that much need, you can sort of allocate things separately. So, all right. There was another article that was, yeah, it's like there's so many articles about like hospitals closing down. So, yeah, and like what's very fascinating is like, there was actually there was a major hospital system here in Wisconsin, or sorry, yeah, in Wisconsin and the surrounding Midwest areas. And the exact same thing happened. Like basically the entire hospital system went bankrupt, shut down. And so patients needed to travel, like, they had to travel like 50 miles away to the nearest hospital in order to just get basic health care. Um, so again, it's extremely sad, like what's going on in the United States. But yeah, I really do think that we need an overhaul of just the entire system, because there's a lot of PACs that like pay money to politicians to just let them keep money. Um, so like hopefully this new administration, whatever your thoughts are on the new administration, again, like, if you were here from the beginning, I'm an American, that's it. Like, I'm not any political party, whatever. I'm a doctor, that's all I am. Like, I'm an American and I'm a doctor. That's really it. So it's like, like, if you I really do want this country to get better. And I just, I hope and pray to God that it does get better. Yeah. Yeah, and what's really fascinating is like, if you go on beckershospitalreview.com, there's so many articles on just like, on all these health insurance companies now. Like, I feel like they're sort of panicking. Like, that's really how it looks. Like, there's, United Healthcare sues CMS over one phone call. So that's fascinating. So United Healthcare is asking a federal court to prevent CMS from, what is CMS? CMS from downgrading its Medicare Advantage star ratings based on one phone call. So based on one phone call. In a lawsuit filed September 30 in the U.S. District Court in the Eastern District of Texas, United Healthcare argued that CMS is poised to downgrade its star ratings based upon a single phone call that lasted less than 10 minutes. CMS determines star rate. Okay, so CMS determines star ratings for MA plans based on several clinical quality and customer service metrics. The agency rates plans' call center adequacy by placing test calls from secret shoppers. Um, wow. Because 100% success is required to be awarded 5 stars on the call center measure, CMS's decisions regarding whether and how to score each call included in the study can have a material impact on plan performance on the call center measure specifically, as well as on a plan's overall star rating, United Healthcare's attorneys wrote. Okay, so basically, so this is kind of funny. So basically, CMS is an organization that rates health insurance groups. So they give them a star rating, and and so it looks like they conducted a secret interview or what have you, a secret assessment, and they lowered the star rating from 5 stars, which is 100%. And so now United Healthcare is very upset over this, and they're suing CMS. So that's kind of funny. Um, but again, like, I feel like this is a really good representation of how these health insurance companies operate and how they think. Like, they really don't care about patients, right? Like, this is just a business. And I think Americans really, really need to conceptualize this. Like, I read something a while ago where like the country of the United States of America is basically just a giant multi-tiered business. And like once I realized this, like I was like, this is horrible. In like it's not human centric. So like in a human centric society, and again, we're all doctors, right? So doctors are people that really we don't care about, we don't, for the most part, physicians care about people, right? That's why we do what we do. So, but it seems like, everything in the United States is really just a way to make money. It's like hyper individualism, and it's like, whose feet can I step on in order to make more money than I did yesterday? Um, so it's a little bit concerning, right? So, but yeah, like this kind of makes sense. Like it kind of tracks with like how, yeah, that makes a lot of sense, Jasmine. Yeah, thank you for that input. Like this is extremely concerning. It's like, but I, and it's like, and they're doing retaliatory things, right? Like they're suing CFS. Like that's hilarious. It's like their job is to ensure quality, and so they're basically suing the organization that ensures quality. Extremely, extremely upsetting. All right, let me see what else. It's insane. I actually had I had an extremely busy day today. Like I had over, I think, how many, like 10 different consults today, and about 8 of them were just really concerning this. Like it's like, inappropriate discharge, or rather not inappropriate, but like early discharge. And again, like, when you do discovery on these medical legal cases, like you learn a lot. Like you learn a lot about like how the system is, and like, all the holes that are in the system. And it really boils down to like everyone is overworked. Like that's really that's really what it is. It's like one human cannot see this, like 20 patients a day. Like that's just not possible. And the way that electronic medical records are, it's like we have to document every single thing. Um, and so, like I kind of envy the days of like, the last generation of doctors and nurses, like where like there was no electronic medical records, right? Like there were just paper records, and so you literally just write like, yeah, like, Miss Johnson comes in, follow up, she needs this prescription pad here. And that was it. That was an entire visit, right? But like now we need to like look back on the patient charts and like document everything and follow up on every single diagnosis. um, so it really isn't a way for, it's not a sustainable model. That's kind of what I'm getting at here. It's that the current healthcare system that we have today, I don't think it's a sustainable model. And whenever you're in a system that's not sustainable, it's inevitable that eventually it will crack. And I feel like, I'm noticing these cracks right now. And what's funny is like a lot of my friends who are in the healthcare field, like in the clinical world, they don't see it. Like they're just like, because they're so busy, right? So like they're so busy just doing what they're supposed to do that they don't have time to look at it from the outside. Um, but yeah, like, I have a friend of mine who's also a family medicine doctor, but he's a clinician, so he does outpatient PCP work. And he was telling me how like, oh, he found this cool hack where you can put in this code in order to get like $5 extra on a patient visit or something. And so I looked it up actually, and I told him all this actually. So I looked it up, and basically the code that they're putting in is basically a way for insurance companies to charge more money to the patient, because the patient is deemed a high the patient is deemed more likely to get illnesses. And so it becomes sort of an ethical problem, right? Because it's like, as a physician, you want the best for your patients, right? So it's like, but I know, and you probably know the code that I'm talking about. So it's like, like as a physician, it's like we want the best for our patients, but I'm a person too, man. Like I have a wife, I have, like I have a family that I have to take care of. So it's like the system has created such a dog eat dog world where even the holiest doctor is going to put in codes to make more money, right? Because it's like, if a doctor is going to spend 1 hour seeing a patient and then insurance is only going to give him 25 bucks, like, is that worth it? Right? So, it's like, I don't blame any individuals. Like, I just blame this American system that it's just, it's getting worse and worse over time. Um, so extremely unfortunate. Yeah. So today's session really, and it's like 6 p.m. So I'm actually gonna head out. But today's session was really, this is just my second live stream ever. So hopefully it went okay. Thank you for all the input everyone had, especially Jasmine. Like, thanks so much. It's good seeing you again. And like, let me know, like, post any comments on any of our videos. Like, if there are any other like Q&A sessions, any live sessions that you guys want in the future, just let us know. But thank you again, everyone, for joining. And until next time, take care and God bless. Bye.